Hi, this is Jessica DeMassa, and I'm at the HISA Studio here at HIC 2017. Right now I'm joined by Alana. Alana, please introduce yourself for everyone watching.
I'm Alana Henderson, and I'm the consumer advocate here at the HISA conference. And I'm here because I've had a very interesting background as a patient, and it's taken me through very many journeys in different ways. But I became a patient several years ago when I had a stroke, cerebral hemorrhage, and ended in hospital with very severe dysphasia. So I couldn't use and I couldn't understand language for quite some time. And 3 weeks later, after had left the hospital because I was so upset and terrified and frightened about the health system, I left and went home, and then 3 weeks later I was diagnosed with breast cancer and diabetes. So I had all of it. I did ask my GP if I could have a heart attack and a renal transplant so I could have the full kit. But he wasn't.
Did you get a discount on that then?
That's right, yeah. He wasn't real keen on that. So we decided to stick with those three things. Addition to that, I also acquired with the stroke what's called an auditory processing disorder. That wasn't diagnosed in hospital at all. My GP diagnosed it down the track, but that was not diagnosed in the hospital. But it meant that I couldn't understand the sound that was around me. So it meant that I often had to ask for people to repeat what they were doing, or if a clinician was really busy and he'd run in and tell me to do something and I wouldn't hear it, so I would take a guess about what they wanted me to do, which meant that they were getting the wrong data, I was getting the wrong information. So problems with communication began right at the very beginning of my hospitalisation. I was so desperate to look like I was pretty normal so I could go home, but yet what I was being asked to do, I was always unsure about what they meant, and so it was really a disaster right from the beginning.
Now, talk real quickly about some of the errors that you found as well in your medical records. So for those who are not with us here at HIC, Alana brought on stage her medical record in paper, and it was about this thick. What is it, 80 pages, is that right?
Yes, yeah.
80 pages?
Yeah, well, I knew that I could get access to my file anyway. I don't know, I've always known that I could. And when it was 6 weeks after I came home from the hospital and I retrieved the file, it's a bit of a interrogation to go through it, to get it. And, they get very defensive about why you want your notes. And I had to pay $33, which is another way that a lot of people would be turned off getting it, because they probably can't afford to that. And so when I had a look at it and I started reading through this file, I was just horrified at what I read. There are 72 errors in my file. Some of them are very little, but some of them are major. But when I started working through that file, I realised that this was the evidence of a culture that was terribly negative, that it had made very disparaging comments about patients, and because they know that the patient's probably not going to read this, there's very little accountability. So there were clearly things that were in error that were there. There were repeated assessments, and I couldn't understand why we had to have so many assessments over and over again, which was very draining as a patient. Sure. But there are so many things in that file that are wrong. And so when I look at that, I think, this is not me. This is not the file of me. Because what I also did when I was in hospital, I kept a diary. So although I had very poor language skills at that time, my advocate got me a writing pad. And so I was writing things down so I could practice over and over when I was on my own, my language, to try and recover my language. But it became my diary, and I wrote down observations of things I saw, things that were done to me, things that were done to other people that really frightened me. So I was terrified in that whole environment, and I came home with my diary, and that became the basis of my book, in giving people an idea of what's going to happen if you're going to these sort of services where you've got long-term hospitalisation potentially, and where you feel like you've got absolutely no control over that environment.
Now, tell me some of the takeaways that you've had. We've talked a little bit about your experience here at HIC, and as the consumer advocate, as the patient advocate, what are you seeing here?
Well, when I talk to people in the community, for instance, they're very unaware of what they can do when they go into the hospital system. So it's not like if you go to buy a car, you ask lots of questions and you feel like you're in the driver's seat, if you like, to make the decisions about that purchase. what we've always thought in Australia is that you go in there, you hand over your independence, your individuality, in a lot of cases your integrity, and you just hand that over with no question. And that's how I felt that I was when I was in there, that I had no power over those things, which really made me unique as a person, but I just hand them over, so you become a number or a blip on the screen, as I said in my presentation. But when we go into the hospital system, we don't ask questions about what's happening. What I do when I go to talk to people in the community, and they might be just community groups that I come in contact or ask me to speak to them, and what I do with them is I talk to them about building a relationship with those health professionals. So you're not going in there waiting until you're angry before you talk to them.
Sure.
When you're first going there, your role really is to build a relationship so your health professionals feel comfortable in talking to you, rather than thinking they're going to be, something really aggressive.
Right.
And so I'm keen to get consumers to start talking to their health professionals right at the very outset, so they build that relationship, and they're more likely then to get on better with their health professional, and also the information that's gathered about them may be better as well.
So last question for you here. I mean, we talked a little bit about, and we're hearing here at HIC about the patient-centered care movement. What are your thoughts on that? Do you feel like this is something that's, that's possible? Tell me your thoughts on it.
Well, if I spoke to 90% of the people at this conference here and I said, what's patient-centered care? They'd say, well, we do that all the time. And then I would say to them, but what do you actually do? In my business, I work with a lot of health professionals anyway, in their professional development. And so I know that they really can't define it. So it gets to the point where I set them up on a table and I say, I want you to give me a definition. Now I want you to give me an example, and then I want you to give me the results of those actions. And they struggle with that. Yeah. So they sort of know what it's about in terms of PCC, they call it.
Sure.
So they know what they think they know, what it's about, but they really are not quite sure that what they actually do in practice.
What is it to you?
To me, it's giving me the autonomy and the confidence to be able to talk to those health professionals and say to them, tell me what you're doing and why you're doing it. Otherwise, I might just want to complain about it because I don't understand it. It also means that health professionals need to improve their health literacy. Extraordinarily, they need to do better at that because they don't know how to talk to me as an individual and how to adapt their communication to suit my needs. And I find that a lot because I work with a lot of health professionals, and I say to them, how do you assess that your patient has understood the fact that you're going to cut their leg off?
Right.
And they'll say to me, well, I just get them to repeat what I've told them. And I say, well, that is not patient-centred care. That is not having the consumer understand what's happening to them. You've got to look at their facial expression. You've got to look at their behaviour. If you met them for the first time yesterday, how has their behaviour changed now? They're the things that you've got to ask yourself as a health professional to know whether or not your patient has understood what you've said.
It's the human side of personalized medicine, right? The communication side. So last thing before we go, if anybody's interested in reading Alana's book, what's the title?
Out of the Fog.
Out of the Fog. And again, your last name?
Henderson.
Alana Henderson, Out of the Fog. Take a look for that. Thank you so much for joining us here. It was a pleasure to have you in the HISA studio. This is Jessica DeMassa at HIC 2017.